My name is Dr. Stephen Walker. I'm a dermatologist based in London. I also have a dedicated leprosy clinic based at the Hospital for Tropical Disease. Another role that I have is as a clinical researcher at the London School of Hygiene and Tropical Medicine. ENLIST stands for the Erythema Nodosum Leprosum International Study Group. And following a meeting in February 2012 in Cebu in the Philippines, ENLIST was created as a network of referral and research centres who were keen to understand better this complication of leprosy, erythema nodosum leprosum. I started my career in leprosy in 2005 doing a PhD with Professor Diana Locke. And it soon became clear to me that there was one group of patients who, even after completing successful antibiotic therapy, had a really torrid course with this condition, erythema nodosum leprosum, which we shortened to ENL. And talking to other clinicians and researchers in the leprosy world, it was clear that everybody had concerns about this condition and felt that it was under-researched and that our powers to actually improve the lives of patients affected by it were limited for various reasons. And so there was really a desire for people to get together to try and pool resources to try and combat this problem, improve our understanding of it, and look for ways to make a tangible difference to people affected by the condition. Leprosy is an infection caused by a mycobacterium, and that infection can cause different appearances and changes in the skin and the nerves, which leads to a lot of the some of the disability that we see with leprosy. One group of patients have a lot of bacteria in their skin, elsewhere in their body. These are the patients who are referred to as having lepromatous leprosy. And because of this large load of bacteria, often when the condition is treated with antibacterials, this leaves a lot of debris from the bacteria lying around in the tissues. That debris, which we call antigen, actually stimulates the immune system. And whereas the live bacteria can effectively hide from the immune system, the dead bacteria and its antigen actually triggers the immune system. So even after successfully treating the infection, you can get this almost like an inflammatory storm, if you like, which creates a very painful condition where people develop new skin lesions, they get more nerve damage, it can affect their eyes, can affect their kidneys, and in men can affect their testes and lead to infertility. The mark of the condition really is that people feel dreadful and they're in a great deal of pain. Now, while a small proportion of people may be affected by this reaction, by this erythema nodosum leprosum type 2 reaction for just a relatively brief period of time of a few months, some people, and in fairness, the majority of people, this will go on for several, if not many years. Our treatments for this are to give immunosuppressive drugs, and the is oral corticosteroid drugs known as prednisolone and similar agents. And they are effective in suppressing the inflammation, but over the longer term, they cause a lot of adverse effects, including weight gain, osteoporosis, which is thinning of the bones, diabetes, blood pressure, cataracts, glaucoma. And we have shown that in some situations, the long-term use of steroids can actually cause problems with people's health and actually in some instances lead to death. So there's an important need for actually finding other treatments with less adverse effects. I'm sure you're probably aware that in the 1960s, thalidomide was shown to be a very effective drug for the type 2 reactions. But obviously, thalidomide is quite a difficult drug to use because of it can cause malformations to fetuses in pregnant women. And so it's not available in many leprosy endemic countries. And even in countries where it is available, people often have to travel long distances to access it. It may only be given on an inpatient basis, so people have to stay in hospital away from their families and unable to work. And even when it's available, it may not be offered to women who are of childbearing potential, meaning that they can't access that treatment. And finally, thalidomide is quite expensive, and for people, the ability to pay and to afford the treatment is very difficult, because although the World Health Organization, through the Novartis Foundation, provide multi-drug therapy, the antibacterial treatments for free, the treatments to treat reactions and type 2 reactions aren't necessarily free, and sometimes patients incur catastrophic economic hardship in trying to manage their ENL and afford treatments for it. So it's a very, very challenging condition. It creates a lot of big impact on people's lives, those who are affected, and if not managed well, can lead to severe complications and even death. I think anybody who's spent time, particularly in leprosy referral centres, will have seen patients with ENL, often being literally carried into the clinical setting by their relatives or friends. And it's, I think, important as we tackle leprosy on many fronts, that we are cognizant of the fact that those people who are affected, who do acquire the infection and do go on to develop the disease, have a burden of disease even after they've been treated successfully with our antibacterial treatment for many years after that is finished. So, for example, patients with ENL will typically be treated for 12 months with antibacterial treatment, and the success story is that their infection has been cured. They will still be having these reactions, they will still be in pain, they will still be at risk of nerve damage and the consequent disability. And even when these reactions have settled down and they no longer need treatment for the reactions, the nerve damage that's left behind can lead to severe pain, neuropathic pain. So damaged nerves can be painful nerves, and that can go on for many years as well, and that too requires treatment, and that treatment is not free. And so we've got this mix of inflammation, pain, and the expense of trying to access treatment, which can all impact negatively on people's lives, their livelihoods, and on their family and wider communities. And so we should always view the problems that leprosy poses, not just in terms of the infection, but in terms of those longer consequences that are going on, which have social consequences and significant psychological morbidity associated with them as well. So, for example, if you imagine a patient attends a clinic, is diagnosed with leprosy, that's quite a devastating diagnosis in and of itself. We are lucky that we have successful antimicrobial therapy to treat the infection with. But imagine being a patient who's taken that treatment, you've asked to be in order to combat the infection. And then maybe 9 months into it, or even sooner, you develop widespread inflammation, severe pain, and are told that this is a complication of leprosy. You will think to yourself, I thought my leprosy was cured. And so this is an important issue, because it goes to the heart of relationships between people who work in leprosy and our clients, and also how people perceive the illness that they've got, because many people don't always fully believe in the model of it's an infection that can be treated by antibiotics. They may have other beliefs around the causation of the disease, and that is further can become further entrenched when people feel that the antibiotics are not working as they were told, and I think that's a real challenge. I think we're still quite early in the process, because we are a relatively small community with relatively limited funding. We've gone from our meeting 10 years ago to have a prospective descriptive study of the clinical features of ENL and what treatments are being used around in many leprosy endemic settings. We've managed to develop a severity scale, so we can actually measure the severity of ENL. And that's very important, because that helps to instruct treatment decisions. And it's also important when we want to do clinical trials to look at new drugs or drugs that aren't commonly used in ENL, so that we can compare different people, different participants in trials, to make sure that we're comparing people of equal severity. I think the other thing that ENLIST has done is publish good quality data around the impact on the quality of life of people affected by ENL. And that, I think, is an important part of the story that often is not told, certainly in biomedical research. And so ensuring that people's quality of life is taken into account in everything that we do is important. And I think that ENLIST has been one of the leaders in that in the leprosy community. We are just about to launch a clinical trial of a drug called methotrexate, which is going to take place in most of the ENLIST centres. It's a very exciting time, and I'm excited because methotrexate is readily available in all leprosy endemic countries. It's cheap, and doctors who provide care for people affected by leprosy are used to using this drug as well. So it would make, if it was shown to be effective, it would add to our ability to treat ENL in an affordable manner. There are some challenges to using methotrexate, as with all the other drugs, but it's exciting that we've got to this stage of starting a randomized controlled trial. Partnership with colleagues in the many leprosy referral centres that are part of ENLIST means that we can share knowledge, expertise, and perspectives as well, which is very important. So that is a study that's being managed by Dr. Barbara de Barros, who's a Brazilian infectious diseases doctor at the London School. And we're just about to implement that. So that's a really exciting piece of work. We have a website which is hosted on the London School of Hygiene and Tropical Medicine's main site, and it's a good source of information on what we've done, what we're doing, and also what we hope to do, and also shows partners. And so depending where you're based, you may want to contact one of the partner institutions directly, or you can contact either myself or Dr. Barbara de Barros at the London School of Hygiene and Tropical Medicine. And we're always looking to sort of extend our collaborations in the work that we do in order to try and improve our understanding of ENL and leprosy reactions in general.